Hello. My presentation today is going to be on how hypertension can be treated with a nitrate-rich diet. In my presentation, I will go through what hypertension is, what effects it has on health, common medical recommendation and treatments for it, my proposed solution of adding nitrate to the diet, and what foods are nitrate-rich. First off, what is hypertension? Hypertension is commonly known as high blood pressure. It is when the heart is pushing too hard, causing it to put too much stress on the artery walls. In a clinical setting, blood pressure is read as systolic over diastolic pressure, and normal should be 120 over 80. High blood pressure is diagnosed depending on how high it is. If it is 120 to 129 systolic with a regular diastolic, it can be seen as elevated. Stage 1 high blood pressure is a systolic pressure between 130 and 139, or diastolic between 80 and 89. Stage 2 high blood pressure is a systolic over 140 or a diastolic over 90. Any systolic pressure over 180 or a diastolic pressure over 120 is considered a hypertensive crisis and should see medical attention immediately. High blood pressure can have many causes, such as genetics, stress, and lifestyle choices, such as drinking and smoking. Now that we know what high blood pressure is, what are its effects? High blood pressure in the body puts increased stress on not just the arteries, but also many organs. When pressure is always high, the heart has to work harder to move blood, leading to cardiovascular diseases like heart attacks and heart failure. High blood pressure can also contribute to kidney failure, vision loss, and stroke. According to the World Health Organization, 13% of deaths worldwide are associated with high blood pressure. Before getting into the prospect of nitrate-rich foods, how is high blood pressure usually treated? One thing doctors usually recommend is weight loss. The Mayo Clinic website on hypertension notes that weight loss can lead to a reduction of blood pressure at a rate of 1 milliliter per of mercury per kilogram lost. Another way to lower blood pressure is through medications. Commonly prescribed medications are ACE inhibitors and diuretics. Both these medications help to lower blood volume, which in turn lowers blood pressure. Once a medication is started, they are often lifelong. Lifestyle changes such as quitting smoking or lowering sodium in the diet are also found to lower blood pressure, as they are known causes of high blood pressure. Reducing stress has also been helpful in reducing pressure, as stress can cause it to be elevated. Doing things like meditating and going to therapy can be beneficial. In recent studies, taking in more nitrate in the diet has been shown to lower blood pressure. So what is it and how does it work? Nitrate is a natural compound made up of nitrogen and oxygen, and it is found in many different types of foods. When nitrate is taken into the body, it is turned into nitrite in the saliva and then into nitric acid in the bloodstream. This nitric acid oxide is the active compound that helps in lowering blood pressure. It does this because it is a strong vasodilator. This means it helps to relax the blood vessels, allowing more space for blood to be and lowering pressure. In 2018, a study done by Sizia Karen L. et al. Had 38 participants in a double-blind clinical trial to evaluate the effects of a nitrate-rich diet on blood pressure. The participants were given either a placebo or a nitrate-rich drink. The chart on the left shows the placebo on the left and the experimental group on the right. In the experimental group, a far lower final blood pressure was found, showing that nitrates were good at causing a decrease in blood pressure when compared to placebo. A study done by Kapil-Vikas et al. In 2010 gave groups 250 milliliters of beetroot juice. The chart on the left has the placebo group on the left and the experimental group on the right. It can be seen that the experimental group showed a larger drop in the before and after columns when compared to the placebo group, which stayed virtually the same. The experimental group had an average blood pressure decrease of 7.7 millimeters mercury in systolic pressure. Now we know that nitrate-rich foods are successful in reducing blood pressure. What foods contain nitrate? Many dark, leafy foods like rhubarb and arugula are rich in nitrate. Beets are an excellent source of nitrate and can even be grinded into a juice. Many of the green plants can be put into smoothies or salads for an easy way to get some nitrate in. Thank you for listening, and try to add some more nitrates to your diet.